I'm joined here this evening by some very, very good friends of mine and some people who have done a number of years of study on the healthcare issue. And I think that we need to talk a little bit about this before we go racing off to make some snap decisions. I think that we need to do that. And I'm joined by a number of my colleagues. I guess I'll start. Would you like to? Yes, I would yield to the gentleman if you'd like. If you want some charts, help yourself, or you got some over here. This is Congressman Shattuck. He's from Arizona. Do you want to talk from the well?
I'll put up some charts if I could.
Let me help you. I'll put some charts up, and you can talk from them.
Got boring charts here. I want to thank the gentleman for yielding, and hopefully we can do this where we're all in a conversation and no one of us talks in a monologue. That makes it more interesting. But I want to thank the gentleman for standing up. I, like he, watched the Democrats in their special order that just preceded us, and I thought some things were very interesting. On the one hand, there are things that I think we agree on. Our Democrat colleagues said that it is tragic when someone has a pre-existing condition or a chronic illness, and because of that pre-existing condition or chronic illness, they can't get care. That's one of the reasons why we Republicans believe that the healthcare system in America desperately needs to be reformed. And the healthcare bill put forward by every Republican that I know of says we need to make sure that every American with a pre-existing condition or a chronic illness can get healthcare costs at roughly the same price as Americans who are healthy. Indeed, I introduced, and the Congress passed a number of years ago, a bill called the State High Risk Insurance Pool Bill that encouraged all 50 states in America to create high risk pools so that for someone for whom they have an illness and that illness or that chronic condition has caused their healthcare costs to rise, and they either can't get healthcare at all or they can only get healthcare at an extraordinarily high price, they have the option of going into a state high-risk pool and getting health care at the same cost. That's not an issue that divides us. That's an issue we agree on. In addition, they express concern about those who are uninsured in America. The bill that I've co-sponsored, and I see several of the gentlemen and ladies who have co-sponsored it with me today, the Ensuring Health Care for All Americans Act, that bill provides health insurance for every single American. It says we are going to provide care to everyone. And our Democrat colleagues say, yeah, we think every American should be able to get care. There's another issue where we agree with our Democrat colleagues. But where we don't agree is how they propose to do it. Because they want a top-down, government-controlled, one plan fits all, you're just one little cog in a very large wheel plan. And that's what the bill they introduced today will do. I have to ask a question. I think that the biggest issue in the healthcare debate is cost. Most Americans are pretty satisfied with their health insurance. 83% say they're happy. But every American is concerned about cost. And I listened when the Democrats introduced their bill today, and the chairman of my committee, Mr. Waxman, said the big issue here is cost. And so the Democrats are going to fix that cost. Now, I don't quite understand how they're going to fix that cost by raising taxes $1.5 trillion to create a massive new government, one-size-fits-all healthcare plan. But I really, really have this burning question. For anybody in America that can answer it, anybody in the room that can answer it, any of my Democrat colleagues out there watching tonight that can answer it, please show me the last time when we got government involved and took over a private sector activity that the cost of something went down.
Just reclaiming my time, gentlemen, I think you've asked an absolutely great question, because we just heard an hour from the Democrats, and that was their whole point. Their whole point is we're going to somehow make the costs go down, which is a little hard to reconcile with a $1.5 trillion estimate. And we just saw, 3 weeks ago, that we jammed through the biggest tax increase in the history of this country. A $787 billion tax on energy. Anybody flips a light switch is going to get taxed, and that's just a drop in the bucket compared to what we want to spend. And somehow this is supposed to be efficiency. Boy, that really stretches along our conscience. You know, we've got a number of medical doctors here today, and one I was just thinking about, Dr. Rowe is from Tennessee. Did you put a program similar to this into Tennessee, and did you find that it really helped the economy of your state? I'd like to yield a little bit of time. I'm going to go to the doctor from Georgia as well in just a moment.
Well, I certainly don't want to take credit for putting that in.
I wasn't going to blame you for that, gentlemen.
What happened in Tennessee was we had a lot of uninsured in Tennessee, and it was a very noble goal of trying to cover as many people as we could, and we had a standard Medicare plan like most states do now. We got a Medicare waiver from HHS, Department of Health and Human Services, to form a managed care plan for the state. And what happened was it was a plan that was very rich in benefits, much like you're seeing in this plan, and that we heard discussed last hour, provided a lot of benefits, but not much access, we found out. And what happened was this plan, this public plan, paid only about 60%, now pays less than, I found out the other day, less than 60% of the cost of actually providing the care. Medicare pays about 90%. So businesses and individuals made a perfectly logical decision. They dropped their private coverage, and about 45% of the people who are on TennCare had private health insurance coverage but chose to drop it. Well, that was fine until we got the bill in this state. And what happened was the bills kept piling up till it consumed more of the state budget than education did.
So wait a minute, just reclaim my time for a minute. You know, one of the trouble with doctors is you guys are so smart. You go pretty fast. You're going to have to slow this down a bit. What happened was the state government said, we're going to give you medical insurance. And so a bunch of people signed up for that. Then the companies that had the private insurance, they dropped theirs because you could go get the freebie stuff from the government. And then guess what happened? The government stuff got really expensive, and now the state's in trouble.